So thank you for being with us today. I've got some announcements, some good news. We received this letter from Department of Health and Human Services moments ago confirming our agreement today. It reads in pertinent part, Mr. Jenkins, thank you for your letter regarding the 2 community-based testing sites in Dallas. Let me assure you that the Department of Health and Human Services and the Federal Emergency Management Agency share your sense of urgency in response to supporting community testing for COVID-19. We have extended the transition period for the 2 federally supported CBTS locations at the Ellis Davis Fieldhouse and the American Airlines Center in Dallas through May 30th of 2020. And so that is, and further, they go on to tell me that we're going to be able to move to a less invasive nasal swab that will save us PPE. We're running short on PPE, and that'll be less painful for you if anybody's ever endured having this done. Still not pleasant, but less painful. And it will save us on the personal protective equipment that we need. So that is very good news. I want to thank Tony Robinson, the Region 6 FEMA leader, and for that, and for the people at HHS, and for Jordan Cox at HHS as well. We very much appreciate their partnership on this. If our website, it looks like it's not going to be up, so I will tell you, if you go on the dallascountycovid.org, there is a link there, and it says got stress, and then it has mental health resources. All right, so we're going through a lot as a community, right? And I'm seeing things in the community that are of great concern to me. I'm seeing a 6-fold increase in the reports of child abuse and domestic violence. So I know we're under a lot of stress, and you don't have to be an abuser to be, to need these services. Regular folks need these services. You can click on that phone number and have a free call with someone who will help you. You can go to any of those links and set up an appointment for people that will help you. Those services are free to you, and we want to encourage people to use them. We are having some technical difficulties with our little televisions tonight. So I will move to, if they got it for me, and I don't know if they did because, like I said, we're having a ton of technical difficulty. Phil, do you have a copy of the report for today?
Yeah.
Let me see the numbers. Good, thanks. All right, so more somewhat preliminary, but good news. What we've seen over the last 6 days is we've hovered at our high days at around 100, and then on Monday, Monday did have some low reporting because of a couple of labs being closed on Sunday, but on Monday we had a low number, and today we only had 63 positive cases, so that is a very good sign. Unfortunately, we suffered our 20th death today. It was a man in his 60s. He had some underlying high-risk health conditions and had been critically ill in a hospital for some time. Currently, about 70% of our folks are either over 60 or are known to have a high-risk chronic condition who are requiring hospitalization. And diabetes has been an underlying high-risk condition in about 29% of all the hospitalizations with COVID-19. So if you have diabetes, be particularly careful. And you can wear one of these. I'll give you a visual aid before I turn it over to Phil, and we'll answer your questions. You can easily make these at home out of 2 hair, what do you call them, those things that you put your ponytail in. And so you just take a cloth like this, you fold it over. Phil will show you too. It also has a tremendous way of making your ears get really big. But you put this on, you use the little thing, you stick it on here. Well, my head's a little big for this one, but at any rate, You stick it on there, and that, Phil, I'll take that off so I can talk to you. Phil has the right size head for his, and this is one of his, so it's a little, probably not great for me. But the point of them is this doesn't necessarily protect you. It provides about 10 to 15% protection for you. But what it does is when we sneeze, when we cough, when we're asymptomatic and we don't know that we have it yet, it provides protection for those around us. What we need to remember, though, is a mask over your head does not mean you need to stay less than 6 feet away. You still need to maintain that 6 foot distance. If possible, depends on how the technology works, Phil's going to take you, or maybe just have to hold up a piece of paper and take you through some information that UT Southwestern, Medical City, and the other hospitals have been compiling that gives us a window into, at least medically, locally, what the guess is as to when this will peak. If that doesn't work, he can tell you about it, and we'll try to get it tweeted out or something. Phil?
So again, as the judge mentioned, 63 new cases reported today, so a total of 1,324. Also, in terms of at the jail, we are now up to, there were 6 additional inmates found to be COVID positive, so a total of 29 inmates, 2 detention officers. With respect to the long-term care facilities now, Monticello West has a total of 7 residents or staff members and 1 death. Skyline Nursing Facility has 32 residents or staff members, 0 deaths. Edgemere has 10 residents or staff members, 2 deaths. The Reserve at Richardson, 7 residents, 0 deaths. West Ridge Nursing Home, 1 staff member. Brentwood Place 1 has 38 residents or staff members. St. Joseph Village has 1 resident. Villages of Dallas has 1 resident. And a new one reporting now is Brentwood Place 2, now has 2 residents confirmed positive. We also did provide more detailed information regarding some of the deaths that we've seen. We had the 20th death reported today. 85% of them presented at the emergency department or were hospital admission, and 3 were actually found deceased at home. 35% were less than 65 years of age, and 65% were 65 or older. 63% had some underlying health condition, and with 37% specifically having diabetes. And then in terms of race, ethnicity, 40% of the deaths were white, 30% Hispanic, 25% black, and 1% other. As the judge mentioned, we've been working with various researchers across the community that have been looking at various modeling, and we're trying to share practices with that, share information, and essentially there are multiple models out there. This is the one that was presented at Commissioner's Court last week. But in summary, really what it shows, and this just shows patient admissions, it shows ventilation needs, and ICU numbers. And so if nothing were done, that's on the left chart, that yellow line shows the number of total hospital beds that would be needed, and it'd be over 17,500 hospital beds. And it shows then the ICU beds is the blue line and others. But bottom line, 17,000 hospitalized beds would be needed if we had done nothing. As the judge mentioned, today we're reporting 63 new cases. All the interventions, the stay home, stay safe, are making a difference. It is flattening the curve. but we need to be vigilant in making sure that that everyone adheres to it. But on that track, based on our own data, it's suggesting that the curve is flattening. That top orange line, following sort of the pattern that we're seeing now, what you can see is the maximum number of beds there is a little over 500, as opposed to that 17,500. So it's a flatter curve, more drawn out, but it is definitely lower peak, and that's within the capacity that we have within our community. If you zoom back out a little bit, what we're also seeing, and it's hard to see, but this is that peak occurring towards the latter part of April, early May. But these are all subject to continued refinement as we get more information. All the researchers are sharing the information and trying to continue to refine the model. And again, there's the assumptions are clearly stated, but those keep, there are variables in that. But that's essentially, you can see the difference in those peaks. We are, based on our own data, flattening the curve. We're estimating that the peak right now may occur towards the end of April or the beginning of May, but this is all subject, it continues to change every day as we're experiencing it. And I'll just show you my own, again, it's really simple, putting it on like that and covering it, and don't touch the top, the front, and just take it off with that and clean it.
Much better job.
All right, thanks.
I believe that has us covered. Do y'all have any questions before we wrap this up?
This is a two-parter for Dr. Wong and you, Judge Jenkins. We're doing a story tonight about discarded PPE that we're seeing a lot of around Dallas. Could you tell us a little bit about that as far as like a possible impact, littering or breaking the law for doing that? Or has the county considered doing anything for littering PPE anywhere? And Dr. Wong, can you possibly talk about the safety impacts of that as well? Just in grocery stores, we're seeing, like parking lots, we're seeing a lot of it in just anywhere.
Okay. Yeah, the question is about tossing off your PPE if you're wearing a mask or gloves to the grocery store and just throwing them on the ground. We certainly don't want that, right? Our grocery store workers are heroes too. They're out there being exposed to hundreds of people a day. If you want to take off your PPE, put it in the trash, please. And Dr. Wong, you want to get your part of the health concern on that?
I mean, as was mentioned, the purpose of these also is for people, it catches the droplets of someone who coughs or even while they're talking. So it would, potentially have contamination, so people shouldn't touch it, and should, certainly if they do have any contact with it, wash their hands afterwards, thoroughly. But, it's something that should be thrown away. Don't touch it if you see it out there, or, just handle it carefully and make sure washing hands afterwards. But
can you all see if you can get the web page up with the phone number for these guys, the mental health phone number? Any other questions before we wrap up today?
The less invasive tests, can you maybe expound upon that at all?
Sure.
Because, yes, it would help save PPE.
Sure. Let me just read you in part from the question was explain the less invasive test. So I'll just read to you what our partner, Erica Swartz, MD, the Deputy Surgeon General, sent me today. Additionally, the U.S. Food and Drug Administration recently approved the nasal self-swab method for use in testing patients for the novel coronavirus. This testing method is less invasive and is both safer for patients and healthcare workers. And so we're going to transition to that in the middle of next week. So essentially, I think I've seen this, y'all have shown it on some of the newscasts. What we do now is we tilt the head back, we take basically a long Q-tip like swab. We put that very deep into the nasal cavity and scrape off something to test, and we pull that out of your nose, and that's not pleasant, and people and we get dirty and you get dirty, and it burns the PPE on that. This is a self swab. It doesn't go in as deep. It allows you to do it. And so it's less unpleasant, and it saves us on PPE. All right. Any other questions?